Doctor, is my dizziness related to my blood pressure? Folks, how are you doing? I'm Dr. Saulo, the neurologist, and today we're going to unravel an intriguing question. And this question makes perfect sense. After all, when our heart, the body's pump, can't maintain an ideal pressure, the first organ to suffer is the brain, which is the most demanding organ in the body. And it sends a signal, and often that signal is, you guessed it, dizziness. Today, you'll understand why, when blood pressure changes, a person can feel dizzy. When your pressure's too low, it causes dizziness and can even make you pass out. When your blood pressure is too high, it also makes you dizzy. And most importantly, what to do in each situation. Let's start with an analogy, okay? Imagine your circulatory system is like the water system in your house. The heart is the water pump. The arteries are the main pipes. And the brain is like a shower on the top floor. In other words, it needs the right amount of pressure to work. When the pressure is too low, it's like a dripping faucet. The water doesn't get there. The brain becomes thirsty for oxygenated blood. And what's one of the first symptoms? Dizziness? It's as if the brain is screaming, hey, I need more fuel up here. Now, if the blood pressure is too high, it's like a hose under pressure. It becomes rigid and can even burst. It's similar with the blood vessels. And that's where the question comes in. But doctor, if the pressure is high, shouldn't more blood get to the brain? Good question. In practice, no, because too much pressure doesn't mean adequate flow. It's kind of like a traffic jam. Lots of cars, but nothing is moving. The blood is there, but it can't flow properly. And here's an important piece of information. The new Brazilian cardiology guidelines already consider a blood pressure of 120/80, 12/8 as a warning sign. Look at that. But that's another story for another video. In other words, what was once seen as perfect, ideal, can today indicate a risk of vascular overload. This changes the way we look at symptoms like dizziness. Let's look at each situation calmly. With low blood pressure or hypotension, the problem is clear. There's a lack of fuel for the brain, a lack of oxygen. The most common signs are dizziness upon standing, blurred or dim vision, that feeling like you're going to faint, but you don't, right? A near faint. Weakness, cold sweats, paleness, the heart races, it beats fast, trying to compensate. It's like a car going uphill without gas. The engine revs, but it doesn't have the strength to get to the top. And the causes are quite diverse, very diverse indeed. From a delay in the reflex that controls blood pressure, the vasovagal reflex, to actual heart diseases, or even neurological conditions, such as, believe it or not, Parkinson's disease, for example. How many of you have gotten out of bed and blacked out for a few seconds? That's postural hypotension. It's actually quite common in a way, but it deserves attention as it could be something more serious. And what should you do in the moment? Sit or lie down immediately, raise your legs, and you can even drink some water with something salty. But only in an emergency and if there are no restrictions. And it's worth remembering that this near fainting from low blood pressure also has a medical name, lipothyemia. That's another term you'll find for dizziness caused by low blood pressure. Now, high blood pressure. Here, things are more complex. The problem isn't a lack of blood, but difficulty with the flow. The vessels become stiff like old hoses, and silent microinfarcts can occur. Small disruptions in the areas responsible for balance, and the brain becomes overloaded. The symptoms here are different. The dizziness is usually more of a heaviness, so it's accompanied by an intense heaviness or a headache in the back of the neck. A feeling of a full, swollen head. You might even have ringing in your ears or blurred vision. And here's a warning. High blood pressure is silent. Many people only find out when it's already causing a more serious symptom. But how do you tell the difference in practice? Well, with low blood pressure, the dizziness appears when you stand up, gets better when you lie down, and comes with cold sweats, a racing heart, and a feeling of almost fainting. With high blood pressure, the dizziness is heavier, right? A heaviness, a tightness in the head. Headaches are more frequent, last longer, and don't get better when you lie down. It can also come with ringing in the ears and blurred vision. And what should you do in each case? If your pressure is low, as I said, lie down with your legs elevated, hydrate, and maybe eating something salty might be necessary. Now, if your pressure's high, stay calm, sit down comfortably, breathe slowly, and if you have prescribed medication for your blood pressure, use it as directed by your doctor. And pay attention, okay? If your pressure is very high, above 18/11, or very low, below 9/6, and it's accompanied by significant symptoms, seek medical help immediately. Go to an emergency room. So pay close attention here, okay? If this content is helping you, like the video and share it with someone who deals with unregulated blood pressure. In the end, it's not enough to just treat the dizziness, right? We have to treat the cause. After all, dizziness is a symptom. So in these cases, we need to treat the unregulated blood pressure. If your pressure is low, take care of your hydration, your diet, and get up slowly. Medication may be necessary in some cases and for certain conditions. If it's high, control your salt, exercise, reduce stress, and stick to your medication. And speaking of which, folks, only use medication with medical guidance, okay? You need to see a doctor if you suffer from low or high blood pressure. The good news is that both high and low blood pressure can be excellently controlled when treated properly. And by controlling the pressure, we control a large part of the dizziness related to it. So remember, pressure-related dizziness is treatable and controllable. The important thing is to identify the cause and follow up with your doctor. And please, don't accept the diagnosis of, oh, it's just labyrinthitis. Without a proper investigation, often the solution lies in a simple measurement, for example, of your blood pressure. Now, I want to know, have you ever noticed a connection between your blood pressure and episodes of dizziness? Comment down below and let's share experiences. And don't forget, please, and don't forget to like the video, subscribe to the channel. A very warm welcome to Neurology and Psychiatry. And share this content with anyone who needs to better understand their own health. A big hug, and brother, your health deserves attention.